How to treat and cure tooth decay. Cavities, also referred to as tooth decay or caries, are holes in the teeth. Cavities are the second most common health disorder in the United States, according to the National Institutes of Health, and a very common disorder worldwide. Some groups have a higher risk for cavities, Lotta Norton told Live Science, including lower-income families, children and adults, senior citizens of all socioeconomic status, people living in areas where the drinking water is not fluoridated, people with diseases and/or medication use that causes a decrease in salivary flow, people undergoing radiation therapy, people with diabetes, tobacco users, both smoking and chewing, alcohol and drug users, people who consume large amounts of carbonated and sugar drinks. Causes: cavities are the result of two primary factors, bacteria in the mouth and a high sugar and starch diet. It is natural to have bacteria in the mouth, but it becomes problematic in the case of poor oral hygiene. Cavities form when bacteria in plaque and tartar convert sugar into acid. According to Lotta Norton, Streptococcus mutans and Streptococcus sobrinus are bacteria especially likely to combine with fermentable carbohydrates like sucrose, fructose and glucose and produce acid. The acid demineralizes the hard structure of the tooth, which over time creates a soft spot, or hole in the tooth called a cavity, Lotta Norton said. The destruction doesn't stop there, reports the Mayo Clinic. After the enamel is worn away, the acid reaches the next layer of the teeth. This layer, called dentin, is softer and susceptible to acid. The bacteria and acid continue to work their way through the tooth, into the pulp, creating a bigger and bigger hole. According to the NIH, cavities are most commonly found where plaque is highly prevalent, such as on the molars, between teeth, near the gum line, and at the edges of fillings. Symptoms: there are often no symptoms of cavities, which is why Lotta Norton stressed the importance of visiting a dentist and having radiographs taken periodically so that cavities can be diagnosed and treated early before they get large enough to cause symptoms. She reported that the most common early symptoms of cavities are a chalky white or discolored spot on a tooth and sensitivity to cold. As the cavity progresses, the decay gets near the nerve, pulp, and can cause pain, which gets progressively worse especially with exposure to heat, cold, sweet foods or drinks, she continued. If the decay gets large enough, part of the tooth may fracture off, leaving a large visible hole, and the tooth may be sensitive to biting pressure. Bad breath and/or a bad taste in the mouth are also symptoms. Cavities on the front teeth are the easiest to see and will look like a brown or black spot. Cavities in other parts of the mouth are often not visible without an X-ray. Prevention: just as there are two factors that cause cavities, there are two main factors to preventing them: oral hygiene and diet change. Reducing the amount of sugar, especially sugary drinks and juices, can help prevent cavities. You may consider brushing your teeth or rinsing your mouth after eating sticky foods. The NIH also suggests incorporating sugary, chewy foods such as dried fruit and candy into a meal rather than eating them as a snack. Minimizing snacking, avoiding constant sipping of sugary drinks, and not sucking on candy or mints can all help, too, because they produce a constant supply of acid in the mouth. The Mayo Clinic suggests looking into dental sealants. Dental sealants may help prevent cavities and are most frequently applied to the teeth of children after their molars come in. Sealants are thin, plastic-like coatings on the surface of the molars that prevent the accumulation of plaque. Fluoride is another cavity prevention strategy encouraged by the Mayo Clinic. It can be consumed in drinking water or as a supplement. Topical fluoride is frequently applied as part of routine dentist visits. Your dentist may also recommend a fluoride toothpaste or mouthwash. Treatment: treatments for cavities include fillings, crowns and root canals. If the lesion is very small and just beginning, It can be treated with fluoride paste and varnish to help stop the progression of the demineralization, Q. Lawton Norton said. If the cavity is formed, however, there is only one option: to remove the decay and put a filling in its place. Fillings. Dentists do fillings by removing the decayed tooth material with a drill and replacing it with silver alloy, gold, porcelain or composite resin. Today, most fillings are composites or tooth-colored. Sometime a silver filling, amalgam, has to be used, Q. Lawton Norton said. Crowns or caps. According to Q. Lawton Norton, if the cavity is very large it may be restored with a crown. These are used if tooth decay is more extensive, the tooth is weakened and there is little remaining tooth structure. The dentist removes the decayed or weakened part of the tooth and fits a crown over the remainder of the tooth. Crowns are usually made of gold, porcelain, or porcelain attached to metal, according to the NIH. Root canal. The NIH reports that root canals are done if decay or injury has killed the nerve in the tooth. The decayed area and the center of the tooth, including the pulp, are removed. The root is filled with a sealing material, the tooth is filled, and a crown is usually applied. Tooth abscesses. A tooth abscess is a complication of tooth decay. Bacteria get into the pulp of the tooth through the cavity and cause infection. Pus then collects in the center of the tooth, causing an abscess. Abscesses can also be caused by trauma to the tooth, such as chipping or breaking, according to the NIH. The NIH warns that tooth abscesses can be a serious problem, leading to complications such as tooth loss, blood infection and infection in soft tissue, jawbone and other areas. Untreated tooth abscesses can cause life-threatening complications. According to the NIH, symptoms of tooth abscesses include severe toothache, the most common symptom. Bitter taste in the mouth. Painful chewing. Sensitivity of the teeth to hot or cold. Swelling of the gum over the infected tooth, it may look like a pimple. Bad breath. General discomfort. Fever. Swollen neck glands. Swollen area of the upper or lower jaw, this is a very serious symptom. If your toothache stops, it is still important to see a dentist. Sometimes toothaches stop if the pulp dies, but the infection may still spread. Treatment for abscesses. Root canals can sometimes save the tooth, but if the infection is severe the tooth may need to be removed. Surgery may be required to drain the abscess. This article is for informational purposes only, and is not meant to offer medical advice.